Hello, everyone. This is Dr. Sherman, and I am going to be facilitating week 3 for you in CMHC 640. And this week we are going to talk about integration in community-based settings. I volunteered to design and facilitate this unit because I have a lot of experience in community-based settings, and I also believe in the importance of community-based mental health. So if you have questions after this, please feel free to reach out. I'm happy to answer them over email or setting up a Zoom or anything that works for you. So we are going to talk about what is a community setting, the role of counselors in a community setting, types of clients and concerns in community settings, case management, and the respectful model. And all of these align with your readings and other materials for this week. Hopefully you've already been through those readings. If not, I think you'll still be fine moving through this before, but I would then follow it up immediately with the readings to give you more context. So what is a community setting? A community setting is anywhere in typically a community that is accessible, affordable, identifies and treats individuals that are often underserved, have disparities from diverse populations. And you can find those in different agencies that are focused on mental health, agencies that focus on wraparound services, such as case management and mental health or counseling. You can find it in hospitals or correctional facilities and integrated healthcare settings, which I know you're going to learn about more in this course. I would also add, after I made this, I thought schools are another community setting. I worked as a mental health counselor in a school setting, so I would add that to the list as well. And I'd love for you to think about what are some community settings near you? Even if you are in a rural area, I bet there are some that you can think of. And you also may need to do a little research, so do some Google searching or look it up on maps and see if you can find some areas that provide mental health that maybe don't stand out as like a private practice or an agency that is, just providing mental health services to a very specific population, such as people who can afford private pay. Community settings really differentiate themselves by providing services to all folks, whether they can afford private pay or not. And so that means that in community settings, you're going to have more folks that come in who need access in an affordable manner. Some examples, just to give you of places that I have worked in. I mentioned that I worked in a school as a mental health counselor. Not only did I see students in that school, but I also treated families if they wanted to come in after school. Sometimes I worked during after care times to treat students and or like do family work. I also worked in an agency called Catholic Charities, which is affiliated with the Catholic Church. However, it was not a religious organization from the perspective of the counselors. So we provided counseling from infancy. We actually had an infant mental health specialist on staff up to elderly care in the community, and that was in a rural location outside of New Orleans. I also worked for a children's advocacy center, which is a community mental health service that's typically mandated by law. My largest number of clientels there were children who were reported as being abused or neglected, and then that report was turned in to Child and Family Services, and then they got referred to me. However, I was also able to serve the community by providing fee-free service when I did not have a full caseload just based on my referrals. And so I was able to build a referral system through the pediatrician's offices and other community services. If they knew that somebody needed healthcare, they needed mental health, and they could not afford to pay someone, they would often refer them to me. And I could basically see anyone except offenders in that setting. All right. So what are the roles of counselors in a community setting? Similar to what you learned in your intro course, you could do lots of things in a community setting. So the obvious one is that you would work as a clinician. You would be the counselor many times in these settings, there's also a great need for supervisors. Student interns and licensure interns often will look for work in community settings. There's a huge bonus to working in a community setting because there often isn't a scarcity of clients. So client hours are more readily accessible. However, supervisors are less accessible, which some of you may have experienced when you were looking for a practicum or internship site. And so if you're working as a clinician, I would also suggest adding that supervisor credential because you'll be doing a lot of good in helping the next generation of counselors get their training. You can also work as a case manager in a community setting. Now, I know you're probably thinking, I thought that's what social workers did. And it is, but you can also do that. And many of the jobs that traditionally are advertised for LCSWs, you will meet criteria for. And so I would encourage you to apply to those if you're interested, specifically those in like hospital settings or nursing homes, other healthcare facilities. They're used to hiring LCSWs, but you have the same training. And in some cases, you have more training, such as specific clinical skills. If you take a look between sort of the classes that an MSW might take and the classes that you will take in this program, you'll see that you definitely have a more focused learning protocol around specific counseling skills. So don't be afraid to apply for jobs that don't say LPC on them. And then finally, administrator. And I think this is maybe something that happens when you stay in an agency for an extended period of time. You become proficient at it and you are promoted. If you have that skill set, if you enjoy doing that work, I know lots of counselors that work in administration in city, state, and federal, like government community agencies. And we're pretty good at it. You know, we have good communication skills and we know how to prioritize and assess. So I think that counselors, if that's something you enjoy doing, are a good fit for administrative roles. Next, we'll talk about clients and concerns in community counseling. So I'm curious what you would think. What types of clients would you see and what types of concerns would you see in community counseling? On the other hand, I'll just say this is sort of a trick question because the answer is all of the above. So clients in community settings will be from all walks of life. And oftentimes it does depend on if the agency or the community setting has a specialization. So for instance, if you're a mental health counselor in a school, you're probably not going to see too many individual adult clients. Usually it would be more of a family context if you did that sort of work. At the same time, if you're working in a hospital setting or just a general care setting in your community, you may see anyone from children through the elderly, individuals, couples, families. You could offer short-term, brief model counseling or long-term care. And the concerns could also be a broad spectrum. So it could be, you know, you work in a trauma-based agency, and so you see mostly trauma-related folks. I've also seen agencies that get grants in specific work. So maybe an agency gets a grant from the state to treat children whose parents have gone to prison. So that will end up being a large percentage of their population because they have a grant that pays the clinicians to do that work. On the other hand, if it's sort of a broad agency like we were at Catholic Charities, we saw everyone and every concern you can imagine. So, you know, I saw teenagers. That was where I had my first client who refused to talk to me, who was a 15-year-old that her parents brought in. And we sat and looked at each other for probably 3 sessions before she started talking or participating in counseling. You could see couples, you could see families. And so community agencies really do serve the community in the broadest way that you can imagine. Community agencies are also where folks may get referred to after they are released from the hospital. So whether that was an involuntary or voluntary hold based on different factors, it could be eating disorder, it could be suicidality or other depression, other presenting concerns. Oftentimes, hospitals will have agreements with community agencies for their clients to go there after they are released from the hospital. So that's where I say there may be some community agencies that serve, more specific diagnoses or severe mental illness concerns. It really just depends on the setting. But one thing I will say is that if you're working in a community setting, it's generally not dull. Day to day, your clients and your concerns will be different, and a strong generalist education, which is what you get in your graduate program, is what you need. Okay, I'm going to talk a little bit about case management in case you are interested in that. Your role will vary if you decide that you want to be in case management or if that's a part of the job that you take. It could depend on what type of setting you're in, the model that they use, the population that they serve, areas of specialty, and their funding source. So again, kind of going back to the grant example, if an agency is being funded by outside sources, it could look different from one to the other. The case management process is actually pretty similar to counseling, except when we get to the implementation stage, you're not typically the one doing the implementation. And the implementation of the treatment or intervention may not just be counseling. It may be outsourcing to support groups, grief groups, 12-step groups. It could be referring out to a primary care physician or a psychiatrist for a specific assessment. And so the implementation of interventions is not going to be primarily something that you do, but you will do the screening, assessment, and planning, and then you'll also do some of the monitoring, review, and evaluation. And as I put as a note at the bottom here, a lot of these can loop back to each other. And for each intervention that you would suggest as a case manager, you do need to go back, monitor, review, and evaluate it. So it's kind of an ongoing process. And then lastly, I just want to point out that the intersection of counseling and case management is really a focus on allied health, where we are connecting care providers for clients. We're recognizing through our holistic model that a client needs to be viewed as a full person and treated as such. And so, we want to talk to, as a counselor, we want to talk to their primary care doctor or their psychologist or their psychiatrist or their teachers if they're a child. And we also really want to focus on the strengths-based model. That's not something that most other healthcare professionals are going to bring in. And it's a unique aspect of our profession that we can highlight for both the client and the other providers. So take a moment and reflect on what types of case management activities you can see yourself doing, and how might a counseling background be beneficial in a case management role? All right, let's move forward. So next we're going to talk about the respectful model. I'm bringing you this model because I've had a lot of students respond positively to it. And while it is older and some of the language isn't always consistent with language that we use now, I still find it to be something that resonates with folks who are working with community-based clients. And I also want to point out before I move to the next slide that when you look at the aspects of this model, it's important for you to think about yourself in these aspects and characteristics, but also your client and how the two of you intersect and do not intersect. Having that awareness will help you plan treatment that is more effective and allow you to show up more authentically. So the main ideas is that this model recognizes that we are complex. There are lots of moving parts that make up our identities. And it focuses on 10 factors that impact our psychological development and personal well-being. So if you think about the wellness wheel plus, who we are as people, it's kind of like putting those things together. Like, what are all of the things that affect who we are as people, but also help us be our best and most well selves. And though there are 10 factors in this model, which seems like a lot, it's not an exhaustive list. And so we need to remember that and consider that, there may be some components that are left out or some components that are important to some of your clients that won't be important to others. So it is a model that I feel like you could apply in a unique way to every client you have based on what's important to them. So here are all of the aspects of the respectful model. I will talk through them a little bit, but I think that the reading assigned does a better job than me just speaking to them. So make sure that you do go in. And remember, this is about you and the client and your intersections, not just the client. The therapeutic relationship is both art and science. And so knowing things about yourself and knowing things about your client and responding to what's important to your client about things from this model, I think are really the important takeaways from it. So the first is religious or spiritual identity. And that could also be broadened, right, to whatever gives you meaning, whatever gives the client meaning. I think that when we step away from using the word religion, we are able to open up our minds and the interpretation of what the word spiritual may mean. Next, we have economic class and background. And I will say, I think that it's important to assess this for both the current functioning, but also past functioning, because even though some folks may have different economic backgrounds than what they are currently living, it can still impact their mental health and functioning. Next, sexual identity. We may also call that affectional identity now. How much does that impact the client and your way of life, your well-being, your sense of self? Next, psychological maturity. This may be a new concept for some of you, and I hope that you'll dig in and read more about this in the article, but I like to focus on this one a little bit because I think that students often aren't sure what to do with that, and really looking into the concept and seeing how you could apply it to yourself will help you figure out how to apply it to your clients. Next, ethnic and racial identity. And I would add to that, like where they are in their developmental stages of their racial identity, which I know you've learned about some in previous classes too. The C is chronological or developmental challenges. And so you could either take this as like challenges that they've had as they progress through their life or developmental challenges that they have currently that may have been brought to light at some other point in their life. The T is threats to well-being and trauma. So it could be either or both. Are there threats to their current well-being? I mean, they're in counseling, so the answer to that is probably yes. What are they? Those may give you a clue to their presenting issues, that a place for you to start. And then trauma history, of course, is so important. So what is the trauma history? How is it affecting their current levels of functioning? How is it affecting their sense of self and their well-being? The F is family background and history. I think that's self-explanatory as to why that's important, so I won't go further into it. U, unique physical characteristics. So this is defined by the client and you if you are thinking about yourself. And how important it is will also vary from person to person. So how are your unique physical characteristics? How important are those in the way that you live your life and your comfort level in your life and so on? And then L is another one that can have kind of double meanings, location of residence, and then also language differences. And sometimes those will go together and sometimes they won't. We can see people move within the same state from a rural location to an urban or urban to rural. The language is the same, but what words mean and how people use their words may be very different. And so talking about that, thinking about that, bringing that up, broaching it to your clients, I think could really bring forth some rich dialogue. So I would love to hear your thoughts on this model after you read the article and do your discussion board, which I guess is where I will see your thoughts on it. I hope that it's helpful. If not, that's okay. There are so many different models out there for you to use to do client conceptualization. This is just one of them. Alrighty. So my final thoughts on this is that community mental health is the first line of treatment for many people. I don't think I can say with enough emphasis how important it is that we have community health resources. Without those, so many people would not have access to any assistance. And I don't want to imagine what that would look like because I think even if we just boil it down to like mental health treatment through an ER visit, that saves lives. And absolutely everything that we would expand from there saves more lives. So I think that community mental health is a cornerstone of mental health. It's actually where our profession started, if you remember back to maybe your career class. And work in the community is hard. Burnout is higher for folks that have big caseloads, that aren't, that struggle with putting boundaries into place and don't have support from their peers and their supervisors. At the same time, there is a way to manage community work to make it not lead to burnout and be rewarding in and of itself. And I will say it is absolutely one of the best learning experiences you can have. You will learn more about your capacity as a counselor and treating just a variety of concerns, diagnoses, different modalities and things like that more in a community setting than you ever would within like a scope of practice for a private practice, especially in your early years. So if you aren't working in a community setting and you haven't before, I would recommend looking into it at some point, whether that's your first job or your next internship or something else. I think that it's really invaluable work for both them and us as the counselor. All right, that's it. I hope that you will do something good for yourself this week. You all are in internship and life is stressful and you are almost to the end, so keep trucking on. There's a picture here of 50 ways to take a break. I hope that you will look at it and choose one to do right now. If not, maybe later. Thanks and have a great day.